Welcome to the slides on how to manage healthcare. This can be sometimes a topic that doesn't seem very fun to talk about, but it's something that's super important, especially as we are getting older and working on our healthcare, knowing where to go, what things we can do, and how to get help. So that's something that we'll focus on in the slideshow. So after reading the information about this in the chapters, you should be able to use some scientific evidence to explain how the power of belief creates a better lifestyle, how the philosophy of lifestyle medicine is, and describe how you would be able to practice it in your own life. Describe the basic elements of the United States healthcare system, including how you would select and use healthcare providers, what kind of health insurance you might want and medicines, and then being able to just analyze healthcare practices, how to complete information, and the alternative medicine information that you might want to take part in as well. So think about optimism and positive thoughts and how they can be really powerful tools that will enable you to achieve goals in life and how you have the power to choose. You give away this power when you put your blame on other people, and it can be really like a self-defeating type of action that we take. So the power to choose our health care and choose how we take care of our health allows for health, happiness, and success to flow into our life. So when you think about, which things do I have control over? How do I feel about myself and life when you think that you don't have any control over things that are happening? That can be daunting. But when you kind of move that power of choice into the equation and think about things that you can do, it makes it feel more settling for our health. So, as we kind of talk through these slides, I want you to think about what are some of the things you can personally do to promote total body wellness. And some of them are just everyday choices that you're going to make that don't even involve going to see a healthcare provider. So, thinking about how just being aware is a powerful thing. Think of some type of excuse that you've had. Maybe someone's decided, I'm not going to quit using vaping until I am done with school because it's too stressful right now. So I'll wait and do that later. Or an excuse might be, oh, I'll work out tomorrow. I just don't have time today. So when someone has an excuse, you can kind of put it through all of these questions and decide how it really comes down to choice. So the excuse that you have, is it actually true? So if someone says that they can't quit vaping until they are finished with school, is that actually true? Probably not. What did the excuse come from? Probably them just wanting to not work as hard as it might feel they have to work to get through that time without it, and they don't want to go through withdrawal symptoms. So the excuse basically comes from allowing themselves to say, well, I just can't do it right now. So is there a payoff? Well, the payoff might at the time feel like, well, then it doesn't have to inconvenience me to try to quit. But what would life look like if that excuse was taken away? Would you have more freedom to be who you are for yourself and to actually be able to feel good about what you're doing? Is there a rational reason that you could change? And definitely, there's going to be a reason why, for instance, vaping is important not to do. Every day that you don't vape is a day that your heart and your body can heal. Can you access universal cooperation and shedding old habits? So sometimes the spiritual dimension of wellness can really help shape us and comfort us when we are embarking on really hard decisions or habit changes that we're going through. So thinking of maybe prayer or aligning to the source of being or whatever it is that gives you that strength can be a very helpful tool. And how can I continuously reinforce this new way of being? It's going to take vigilance, it's going to take work, but it is something that is important and can help you. So part of the way I want you to approach healthcare is being able to think about eliminating excuses that you might have in your own life that are allowing you to do really unhealthy things that make you more susceptible to chronic illnesses. So there is some scientific proof that there is definitely help in our body for power to choose. Epigenetic scientists are studying the signals that activate specific genes in our DNA, and these triggers can range from chemicals and hormones to frequencies, thoughts, or even feelings. So these are some things that are being studied right now. And what they've looked at is DNA in our cells is not really self-emergent. They don't have like their own brain where they're thinking just for themselves. It does not completely control our destiny, so to speak. We actually have way more control. So there's this idea of the placebo and nocebo effect, where some people are just told, okay, you're not going to get better. This is something that you just can't get rid of. And when they hear that, they're going to most likely cling to that and think, oh, I just can't really get better. And then there's this other thought that, okay, if someone tells them, oh, you're going to get better, it's just going to take a couple weeks and then you'll feel better. Sometimes just being told that is enough for your brain to help signal to your body, hey, I'm going to heal, I'm going to get better. And that can make a really big difference in changing and having your body heal. A lot of times we don't think about that. We think medicine might be the only thing that can change us, but sometimes it's truly the way we look at the situation. And we talked about this a lot in our stress situation when we went over how body is affected by stress, how looking at stress can be more of a growth mindset, and that can really be thrown into this area as well. So think about this. Lifestyle medicine is becoming the preferred approach to the prevention and treatment of most chronic diseases. Preventative medicine is another term used to describe medical efforts to promote healthy lifestyles. So these are things that you actually can be doing that count as medicine, so to speak. Eating properly with nutrition, getting enough exercise, at least 30 minutes a day at your age or more, taking care of your stress, looking at it with that growth mindset. Smoking cessation, if it's in your life, getting that out of your life, whether it takes weeks, months, years to keep quitting. And then just having meaning in your life, the way you look at your life, how things are, and your purpose is so helpful to your body healing. So the focus is to help people live healthy lives instead of just doing things differently and then become ill. So it's all about prevention and being able to stop those things from happening. So how could lifestyle medicine improve the quality of your care? How would it benefit you and would you use it? So just think about yourself. How could you take some of those different aspects that I just covered in the last slide and really start putting them into your daily life? And what are some ways it would benefit you? For instance, if you decided to start making sure you're getting all your fruits and vegetables every day, what are some benefits it would give you? It's going to help decrease cancer risk. It's going to help your immune system to be stronger. So thinking of, okay, what are specific ways I can be benefited? And then would I do this? Like, is it worth the time? And I hope for you that there's at least a couple or one of those things that you'd be willing to use. So when it comes to selecting healthcare providers, a primary care provider is the first person you visit when you have a medical problem. And so it's nice to have someone that lines up with your thinking. So if you tend to like more holistic health opportunities versus Western medicine opportunities, then you might want to go to someone who has that same thought pattern as you. But keeping in mind that you want to have it be someone that you can see for basic things like allergies, cold, flu. The secondary care practitioners are the ones that are specialists, like a dermatologist, if you need to see someone that specializes in an area. So when you are selecting your healthcare provider, obviously there's lots of places, and it might depend on where you live. That's going to sometimes make it so you only have certain options. And in college, obviously you can go to our university health center and get help there for just some minor things and to get help even being referred to some other place if you need it. Some health insurances only have certain physicians in their network, so you might have to choose from that. Referrals are great if you know of friends and family members that try certain people and like them. That is worth so much to go and see someone that you know is trustworthy. So other things to factor in are like, what are their office hours? How do they communicate? Do they make it so you can use a portal? Because a lot of times you have a quick question and you don't want to have to make an appointment just for an answer for one quick question, especially if you were just there 2 days ago. So how do they communicate? Is it close by? Will they do some types of online visits that might be helpful for telehealth care. And you just want to be able to trust them and be open with them. So those are all things to consider when you're choosing a healthcare provider. Other things that you need to just kind of think about are health insurance protects you from high cost of healthcare, but it still has a cost. And so I remember when I first started my teaching career, I had really great insurance and there wasn't any type of money taken out of my paycheck. It was 100% coverage and it was amazing. But then throughout those years, I of course started having more cost for just monthly fees and then started to pay for more of a deductible and things like that. So it changes also, but you want to try to get the best one you can get for um, where you are working. Keep in mind that cost is driven by risk. Sometimes they will tell you, oh, it's going to be a lot more money because you have heart disease. But the Affordable Care Act provides benefits to all Americans. You can't be denied insurance if you have a pre-existing health condition. Young adults can remain on their parents' insurance until they're 26, and your insurance policy cannot be canceled because of an innocent mistake on your health insurance application. And you can more easily appeal decisions by insurance companies to deny payment of an insurance claim. And annual or lifetime limits cannot be put on your health insurance benefits. So there's a lot of things to think about. And because there's many types of plans like HMOs, PPOs, these are things that maybe you've heard these before. Some of them you have to stay within the network of doctors. Some of them you can go out of the network, which is more of a PPO. Some of them have really high deductibles. Like I know some people have like up to 6,000 or more that they pay on their own out of their pocket, and then the plan kicks in. So it just depends on what plan you have. And then there's of course government programs as well, seeking Medicare and Medicaid that can be helpful to people when they are needing assistance, and especially as they get older, or even if they're not in a higher age bracket but just need help with their medical costs. Premiums are just how much you pay each month to the insurance company that can come right out of your paycheck from where you work. Deductibles are, again, the amount you have to pay before the insurer does start to pay. And then copays sometimes are really low, sometimes they're higher. It really just depends on the insurance plan that you have. And I highly recommend talking to a human resource officer from wherever you do have a job and getting things answered, because sometimes there's different packages you can choose from and you want to really make sure that you're making the best choice for you. You can go to healthcare.gov to learn more about the benefits I was just talking about earlier with the Affordable Care Act. So just something to think about. So if you are taking medication and it's something that you can't avoid, you want to make sure you're taking it as recommended, that every drug has side effects, no matter what drug you take. So you want to know that those things can happen and be looking for them if they're something severe. Know that antibiotic use has been overused. So if it's possible and you're just having a virus take place, not to take the antibiotic until things change and can become something more intense. And then supplements should never take the place of eating well. They should always be um, something that you take only. So integrative medicine is that practice of healing the whole individual, not just thinking about an ailment. So maybe if someone is having pain in their abdomen, there's something causing it, and it's not just something that's happening just there. It could be coming from another area of the body that's signaling to that spot. So they like to put everything together, and it's not going to have the same level of rigor for certifications for physicians, but it can be very helpful, especially depending on what type of ailment you have going on. So, for instance, someone might be having migraines, and maybe having acupuncture really helps them manage those migraines. So there's different ways to go about trying it, and sometimes if you've tried other things and they haven't worked, it's worth trying those, or vice versa. Try integrative medicine first, and then if it's not working for you, then maybe go into other options with doctors. But just being aware of what you can do. Some other examples are traditional Chinese medicine. They really focus on energy pathways in our body and how they kind of have things that can be blocking them, whether it's trauma, whether it's something that's happened. So they try to open those pathways. Acupuncture and acupressure are putting, obviously, in certain points of the body in those meridians pressure, and it can help with things again like having migraines that might really plague people. Qigong is meditation and exercise that focuses also on acupuncture points. Emotional freedom technique is one where you work on tapping different parts of the body in a pattern, and then you can actually try. I see videos online, and it tries to also focus on some of those points, but it really helps to open up if someone has a certain emotion that they're kind of keeping pent up in their body, can help kind of open that pathway and gives their body permission to heal. Sometimes we don't realize we're holding on to an emotion, especially if we've had trauma, and we just need to let that go. And then chiropractic is another way to work on aligning the spine and the muscular system so that they can give the body more opportunity to move freely and can also help with opening up some of those pathways. So moving forward, experience the powerful effect that your beliefs have on the aspects in your life and all dimensions of your being. So think about, even though something may work, if you're telling yourself it can't work, it's probably not going to. So how we look at it makes a huge difference. Understand epigenetics and the realization that your destiny and your health, all those things are very much in your hands. So being able to think about, how am I going to treat my body? Am I going to eat healthy? Am I going to do the things I can for lifestyle? Consider possible benefits from complementary and alternative medicine in addition to conventional medicine, and then develop the skills and make a commitment to stay physically active now and throughout your life, because that isn't going to go away as far as how it's going to benefit you. All these things can be really helpful. I hope as you're taking your journey through your health that you're thinking about, okay, what are some things I could try that maybe I haven't tried before, and really start to adapt into my lifestyle so that I can have the best health possible. Best of luck.